Here's today's Genesis Medical Moments.
We are continuing our conversation about the LINQ implant with Dr. John Hartman with Genesis Medical Center. So, doctor, how is LINQ different from other more traditional surgeries that have been done in the past for, say, maybe GERD or acid reflux?
Absolutely. So typically when we're doing a surgery for acid reflux, it involves mobilizing the stomach, which means freeing the stomach up, taking down some of the blood vessels around it, and then performing a wrap of that stomach around the esophagus. And that wrap creates a high pressure area to stop reflux. So you're altering the anatomy when you're doing that. With the LINQ, we just make a very small incision through the tissues around the esophagus, and then we're able to place our device without disrupting any of the other anatomy related to the stomach. So it's a significant difference.
And this is all through robotics, right?
All robotically, yes, that's right.
That's amazing. That's just amazing. And is this an outpatient surgery?
Absolutely can be.
Okay.
And people go home, and the other benefit to them is that they can eat right away, eat a regular diet right away. Typically with a Nissen, we don't allow people to do that. They're on a liquid diet, but we want people with the LINQ eating every 2 hours.
Okay, well, that's good to hear.
Yeah.
That's good to hear. How does a patient know if LINQ is right for them?
Sure. So it's something they can come in and talk to us about, and we have a lot of information. We put them through a series of tests, one of which is measuring the pH in their esophagus to see if they're truly having reflux symptoms. And then if we think they're going to be a candidate for surgical intervention, then we get a thing that's called a manometry. And the manometry measures how strong the esophagus is, and if the esophagus is normal, then they would be a candidate for the LINQ.
Okay, so what should someone know prior to getting this implant?
Sure. So the things people worry about with a foreign body like that is how often does it have to come out? And it's only about 6% of the time that it eventually would have to be removed for one reason or another. Typically the reasons to remove it are people who are having a difficult time swallowing and they don't get better with any of the other interventions that we use. It typically does not erode or cut into the esophagus. That's incredibly unusual. And the other thing about the LINQ itself is if you have to take it out, it's pretty straightforward. It's pretty easy to get out if somebody decides that it's not right for them.
Okay, so is there any physical therapy involved, and what is the recovery time?
Most people get to go home the same day or the next day, depending on how things go. There's no physical therapy required other than that having to eat small amounts every 2 hours. And what that does is it actuates the magnets. So it keeps them moving so that they won't scar in place and be too tight. And patients really like the being able to eat every 2 hours and eat regular foods.
All right. Any other side effects? You mentioned a couple, but are any other side effects that you want to go over that maybe people might experience?
Absolutely. So the biggest thing that people complain about once the LINQ is in place is around 6 weeks. It gets really hard to swallow because that's kind of the maximum scarring there. So it's uncomfortable. Not everybody has that. Our last 3 patients said it really wasn't as bad as they thought it would be. But that is the thing that people complain about the most is having a hard time swallowing. And usually about 6 to 8 weeks out, that's getting a lot better.
So would this implant eventually need to be replaced?
So every once in a while, it has to be replaced, but that's incredibly rare. And that's the advantage with this approach is Nissen, where we do a wrap, that typically lasts 8 to 10 years, and then it'll need to be redone. And with the magnets, very uncommon to have to redo it.
Well, that's some great news, definitely. Well, it's so neat to hear about this procedure, and thanks for taking the time to talk to us about it.
Absolutely.
All right, this was your Genesis Medical Moments, and for more information, go to ourquadcities.com and click on